Hi, it's Dr. Carling from the Carling Adrenal Center. Let's talk about obesity, adrenal tumors, and surgery. Obesity, adrenal tumors, and surgery. So let's explore how adrenal tumors can drive obesity and why being obese can delay or prevent surgery and what steps you as a patient need to take to make surgery safer. So adrenal tumors can cause significant weight gain by disrupting your body's hormonal balance. So for instance, in Cushing syndrome, you have too much cortisol, and that promotes fat storage, especially in the midsection, in the abdomen, what we call central obesity. Another condition called primary aldosteronism, where we have aldosterone producing tumors, also can cause fat gain and obesity. And so let's talk about why obesity complicates adrenal surgery. Well, the adrenal glands are smack in the middle of your body. So whether you do the operation through the front or the best way, going through the back, there's some distance to travel to get to the adrenal glands, and that is covered in fat. So obesity is defined by the body mass index, or a BMI, and a BMI greater than 40 or higher is defined as obesity. So you calculate your BMI by dividing your height by your weight. That's just the standard measure of body fat. So for adrenal surgery, a BMI over 40, classified as morbid obesity, significantly increases the risks of surgery. So if your BMI is higher than 40, surgery becomes more dangerous because you have a higher risk of infections, blood clots, delayed wound healing, anesthesia complications, and prolonged operative times. And sometimes, frankly, it's not even possible to do the operation because the working space is smaller and there's just too much fat in the retroperitoneum. So who needs to lose weight before surgery? Well, most patients are advised to lose about 10 to 20 pounds before surgery, depending, of course, on their starting point. And the weight loss can improve surgical outcomes, shorten the recovery time, and lower complications. But achieving this is not always that straightforward. In general, losing weight is not that easy, and especially if you're fighting against an adrenal tumor, it can make it very hard. So in some cases, your doctor might recommend medications to manage your hormone levels before surgery. For Cushing syndrome, drugs like Korlym or Isturisa can control the cortisol with added weight loss. And for patients with PA, often spironolactone or eplerenone is used to counter the effect of the aldosterone in preparation for surgery. And nowadays there's a lot of weight loss medications, I'm sure all of you know about, that can be used, and in some extreme cases bariatric surgery, often a sleeve gastrectomy, is needed in preparation for adrenal surgery. And this medical treatment should be discussed with your doctor prior to adrenal surgery. So surgery, particularly the mini back spironolactone, all of you know that's the best operation. That's the gold standard for curing conditions like PA and adrenal hypercortisolism, meaning Cushing syndrome. And removing the tumor normalizes the hormone levels, which then after the operation leads to significant weight loss and improved health. But to get to surgery safely, addressing obesity is critical. So if you're experiencing unexplained weight gain, consult with your doctor to explore whether you have an underlying adrenal tumor. And early detection can make all the difference. So thank you very much for watching.